Brian, no, he just loved it. Loved listening to them, and they really got an awful lot out of him. The laughs, it just couldn't. Once he started to laugh, they couldn't stop him.
It can be a very intense place here, and they can take them away from their worries and all anxieties that they're feeling here.
They just opened up their routine, and they were climbing over chairs and falling on the floor, and Stephen just giggled his heart out, you know what I mean? He just really laughed that hard.
They actually get to know the children really, really well, and they actually know what they like and what they don't like.
I think it makes them feel special, and it makes them feel it's somebody that's just for them.
What they bring is fun. They bring a levity to what for many children are very serious and very scary situations.
Took her mind completely off everything and gave her something to focus on for 5 minutes, so it was good.
It's playing, that's what it is. It's just going out and playing and communicating with the kid. And
there are loads of benefits, and it's fun for hopefully everyone that comes into contact with us.
Another busy day at the office for Dr. Sparky and Dr. Twinkle. They've got things to do, people to see, jokes to tell.
Who are you? What do you feed your babies?
Chips with mint sauce, please.
The Clown Doctors first laughed their way into a children's ward in 2005. Since then, they have brought light relief to thousands of seriously ill and life-limited children in 4 major hospitals across Northern Ireland. Working alongside real doctors and nurses, a clown doctor's role is to focus on the child, not the illness. Clown doctors have no medical training. What they do have is a love of performing, a vivid imagination, and the gift of connecting with children of all ages and abilities. When Arts Care launched the Clown Doctors project, it was a new concept for Northern Ireland. But now it's hard to imagine these wards without their weekly prescription of Clown Doctor magic.
You know when the Clown Doctors are here, the sound has changed, even though they're singing, the children are bounding about, you know, they look forward to the Clown Doctors coming. So it's not even when they're here, it's the whole build up to the Clown Doctors coming. Even with the staff know that Thursday is Clown Doctor Day. Some of the staff actually want to be a Clown Doctor, you know, so they change the whole environment.
It's not easy being a child in hospital. Separated from friends and family, the wards are noisy and the days are long. This is Oren Tom's 4th week in hospital, and anything that alleviates the boredom is very welcome.
When he's here, like, he's always smiling. Like, well, he smiles all the time, but there's something, you know, which is a wee bit of a change for him. Like, you know, from just seeing the ordinary nurses, like, when they come on, like, it lifts them, like, something different, like.
So we'll see you later, alligator. Here, give us a squeak. Oops. Thank you.
Yes. Get a squeak. Thank you.
See you, penguin. Bye.
Truly, some of these children have been through an awful lot, and they've suffered a lot of pain, and hospitals are not their favourite places, and having people who can make them laugh, tell them funny stories, is a great adjunct to any therapy.
Sometimes when things get really heavy in the wards and maybe a lot of sadness, it's nice to have like a ray of sunshine coming in on Thursday. We know Thursday's Clown Doctor Day, and watching children's reaction to them as they come into each bay, it's just great.
Laughter. Laughter is the best medicine. They told me that many years ago, and it's true.
And laughter has worked for Emer McKinney, who's just returned to the ward after having surgery on her leg. Although she's in pain, she still manages a smile or two.
Who's there?
The interrupted sheep.
The interrupted sheep.
They're very good. They're very good, particularly with some of our younger children. You know, they sort of lift the mood a wee bit with some of them. A lot of our ones sort of pre-op that are there's a lot of anxiety and worries about going to theatre, and some of them coming back as well. Some of them who are sore, they provide a good distraction.
They allow them to see doctors in a slightly more humorous light, and they often allow us to introduce investigations or treatments. So a good example today was we were trying to do some ultrasound of a 2-year-old's joints, and they were having none of it. It was a very stressful situation. I abandoned the procedure and allowed the clown doctors to hold the probes, look at the machine, look at the pictures with the child, play a game with them, make it fun.
Ah, yes, yeah.
It's a good nose.
That works on everything, doesn't it?
What is that?
And then even a matter of minutes when I came back in again, the child has at least got to the point where they're allowing me to hold the probe on their joint. So hopefully by the next visit we'll be able to do joint ultrasound, which we probably would not have been able to do until they're perhaps 4 or 5.
I can really get a sense of why it is so good, because the kids come out of themselves. I mean, today one child was able to go through a procedure because I went through the procedure, and she said, "Oh, it's all right," you know. And I wasn't. I had no, I had no other connection other than that. So it was, that's why it's important, because the kids feel safer, and they have a bit of fun, and it's not just an institution, and it's not impersonal.
Who's that? Who's that? Who's that? That's me. That's Dr. Twinkle. And that's Dr. Sparky.
Don't have the same hair, don't
And that's Dr. Fizz. And that's Dr. Clueless.
I mean, the staff in the children's wards are fabulous. Everywhere that we work, they're just great. And we just bring a little bit more colour in. And sometimes if someone's in for a long period of time, you kind of get into the rut. Well, what did the doctor say today? What did you have for lunch? And if we've come in and we've told them some really appalling jokes, they have something else to talk about with their visitor.
For some children, their medical condition means they can't always do the things that other children take for granted. But that doesn't stop 9-year-old Sam and his twin brother Dylan from making the most of their playtime.
Dylan and Sam were born 15 weeks premature. They have had several complications when they were very little, which has led to them both having partial vision. Dylan is profoundly deaf. He also has some movement difficulties, and he has very bad epilepsy as well. Sam has been left more physically challenged than Dylan. He has quadriplegic cerebral palsy and is unable to sit up by himself and things like that. He's also has epilepsy as well, but is more social than his brother and would interact more than his brother would. The medical challenges are really, what comes from that, various orthopaedic things, wearing contact lenses, things like that, and also medications on a daily basis. Before we came to Northern Ireland, we'd lived in North Yorkshire for about 8 years, and we'd never come across the clown doctors before. It sort of had play specialists and things in hospital, but never anything like the clown doctors that's specifically there for entertaining and taking their mind off what's about to happen, or, them just being in hospital in general. For Sam, recently, at the beginning of January, he was in for an operation on his legs and was making like a hole in the water is probably the best way to describe it. He wasn't making eye contact with anybody, he wasn't engaging with anybody, and he's sort of very suspicious of anybody that came near him because he knew something was going on. And the clown doctors came in, and he would see them on quite a regular basis, and they managed to get him to start laughing and carrying on his usual self, really very being very social and interactive and things like that. Dylan would enjoy, he would make it obvious what he wanted to do by either taking their hand and leading them to the object or the toy that he wanted to play with, or take their hand and sort of move as if to go away to go for a walk or something like that. And the fact that they know that is what that means, they don't just sort of, oh, he's just pulling my hand. They know that he wants to go for a walk because they remember these things about the children, which is wonderful. They're dressed like a doctor, and they're not coming to stick a needle in them, they're not coming to take blood, they're not coming to give them any medication or draw on their legs or anything like that.
you know, it's just something that's fun and it's something that makes them laugh and something they enjoy. It's nice that someone remembers the different little things and that they have that attention to detail, and I think it makes a child feel special, especially if they're coming into regular contact with them, that they remember the things that they like and the things they want to do. I think it makes a big difference.
Stephen was actually stillborn and then resuscitated, and through the resuscitation then he was left quadriplegic cerebral palsy. He has asthma, epilepsy and microcephaly. They were talking about turning the machines off, but Stephen started to rally round a bit. It's just been here ever since, really, you know, so he was a wee fighter and he's just fought back.
Johnny has epilepsy, and every now and again it will be quite severe, which it ends up in hospital.
The fact that he can't communicate is a major, major downfall. Even for him to be able to stand there and say yes and no, that would be a major achievement for us.
When the clown doctors are around, it's not just the children who benefit.
When you have a disabled child, you feel that no one can look after them as well as yourself. And I suppose maybe most parents feel that about their children, whether they've got disabilities or not, you know, but just for 5 minutes or even 10 minutes, you know, while they were there entertaining them, I was able to go off by myself and just have 5 minutes to me and get a wee cup of tea and a breath of fresh air, really, you know. So 5 minutes to me is like an hour really to anybody else, you know, and the clown doctors just make that 5 minutes very, very important. They just seem to take over what I would probably be doing, you know, and it just gives me that reassurance that he is being cared for and that there is other people that genuinely feel what I feel for him.
The clown doctors will never ever ask me, what can Johnny do, what can Johnny not do? They leave that upon themselves to find out.
Johnny always seems to go for people's faces, and he pulls the things out of their pockets and throws them onto the ground, and he thinks this is funny because they're playing a game with him. They're picking the things up after him and he's throwing them down again, which has always been a funny game for Johnny.
They're including him in what they're doing. So he's not really a disabled child, he's just a child that needs someone to get him to join in.
You're sitting feeling a wee bit blue, and Johnny's feeding off that. He knows that you're not just 100%. And then all of a sudden the clown doctors come in, all that changes within a few minutes. That he starts to feel happy, and of course he's laughing and joking. It's nice, like, you know, and knowing that he's been 100% entertainment and he's in good hands, you know.
When you're there in the hospital and you just see the joy that comes in, you know, when the clown doctors and that come, it makes you realise that for me as a parent, seeing my son get the enjoyment that he gets, then it's actually taken his mind off what he's going through. And we appreciate it as a family. I mean, we do appreciate them, you know, and there's just not enough of them, unfortunately. There really isn't, you know. So, I mean, the more the merrier.
With just 4